Diabetes is a problem that is affecting more and more people today. By now everyone knows that there are two types of this. One is hereditary, genetically type 1 diabetes. The other is our lifestyle, type 2 diabetes due to external causes. But Scandinavian scientists who have analyzed the causes of diabetes and other factors have proposed 5 types of diabetes. That is why they say that it is very easy to diagnose and treat diabetes. And the types that are currently in diabetes. Let's look at the types, causes, and other factors that new scientists are saying. Diabetes is a condition in which the level of glucose, sugar, in the blood exceeds the limit. It is currently classified into 2 types. One is type 1 and the other is type 2 diabetes. Type 1 diabetes. Type 1 diabetes is the lack of actual production of insulin, which helps control blood glucose. The pancreas gland produces insulin in the body. However, the body's immune system mistakenly attacks cells in the pancreas to produce insulin. Stop. The genetic causes of this problem are many. Type 1 diabetes most often starts at a young age. Type 2 diabetes. In this type of diabetes, the body not only loses insulin production but also loses the actual insulin it needs. This means that even when insulin is being produced, the cells in the body become unresponsive to the immune system. Changing lifestyles, obesity, and a variety of diseases can cause type 2 diabetes. Usually, it starts in middle age, i.e., 40 to 45 years. Scandinavian scientists have conducted extensive research on the topic of diabetes in Sweden and Finland. The article was also published in the journal The Lancet Diabetes and Endocrinology with their findings and proposals. According to it, scientists have proposed 5 types of diabetes. One of them is type 1 diabetes and the other 4 are subtypes of type 2 diabetes. These are referred to as clusters. Here are 5 common types of diabetes. Cluster 1, this is referred to as severe autoimmune diabetes. Due to the attack of the pancreas immune system, the body does not produce insulin. It is a type of diabetes that occurs at an early age without any problems such as obesity. This is caused by genetic factors. Cluster 2, this is severe insulin deficient diabetes, severe diabetes with low insulin production. Insulin production is also low in this type of diabetes. Even without obesity, this problem arises at a young age. However, it does not involve the immune system attacking the pancreas. But there are defects in the pancreas gland cells themselves. They are not able to produce enough insulin. This may be due to genetic factors. Cluster 3, this is called severe insulin-resistant diabetes, severe diabetes caused by resistance to insulin. It is a type of diabetes that affects overweight and obese people. Insulin is produced in adequate doses in them. The body cells do not consume it. It is caused by changes in our lifestyle, obesity, and certain diseases. Cluster 4, this is mild obesity-related diabetes. It is a mild form of diabetes caused by obesity and overweight. It is mild to moderate, similar to cluster 3 diabetes. Weight loss will be followed by fatigue and constant tiredness. Cluster 5, this is referred to as mild age-related diabetes. It is almost identical to cluster 4 diabetes. However, even without obesity, diabetes comes due to aging. This problem usually arises after the age of 45 to 50 years. Scientists say that drugs are easier to control if used with proper care. What if all were treated the same? According to scientists, there is a big difference between the first and second types of diabetes. But currently, both of these are considered under severe type 1 diabetes. Hence there are conditions that provide the same type of treatment. This will not bring relief to the victims. It has been found that people with cluster 3 diabetes are more likely to have kidney problems. Cluster 2 diabetes has been shown to cause retinopathy, damage to the eyes. And there are easy ways to control cluster 4 and cluster 5 diabetes. But scientists say the problems are compounded by the fact that they are considered completely under severe diabetes. According to the new classification, it is clear that the problem of any cluster will be treated with appropriate treatment and drugs. Is it possible to provide appropriate treatment? Dr. Kathleen Vine, a scientist at Ohio State University, says that categorizing diabetes into 5 types can be very beneficial and can identify the specific cause and treat it accordingly. However, the current diagnostic system will remain the same, it will be diagnosed according to the subcategories. International scientists have focused on this latest approach. It is possible that more research could be done to implement it.